Alright, so we are going to go over drug classes and schedules. Um, Wonderful chapter, lots to learn, lots to know, things that definitely apply to you as medics. Okay. The first step, the first part that we're going to deal with here, oh my goodness, move myself. There we go. Ha! Okay, so the first step that we have here is the therapeutic and pharmacologic classification of drugs. What we're dealing with here, that is the first broad way that we classify drugs. Okay, we classify them as therapeutic level, method of organizing drugs by their usefulness, okay, for treating a particular disease. The pharmacological classification, however, is classifying the drug by how the drug works at the molecular, tissue, and body system levels. You may also find this in the drug book as mechanism of action. Okay. The therapeutic classification focus. This is a slide really just to kind of show you how it would look in a drug book or whatever. It's useful for example, so you might have influencing blood clotting. The drug classification would be then an anticoagulant. Okay, lowering blood pressure. That would be an antihypertensive. Okay, restoring normal cardiac rhythm. That'd be an antidiuretic. Excuse me, an antidysrhythmic. Okay. Um, we also will have another slide here about mechanism of action, and this is using the pharmacotherapy for hypertension. Okay, high blood pressure. And so you might have a mechanism of action of drugs that are lowering blood plasma volume. Those would be your diuretics. Blocking heart calcium channels. A calcium channel block. Blocks physiological reactions to stress. That'd be an adrenergic antagonist. When you see antagonist, think of antagonizing something to stop it. Okay. Dilating the peripheral blood vessels. That'd be your vasodilator, and you should know which one that we typically have been trained on to use for that. Nitroglycerin. Okay. Prototype drugs. These are drugs that are they are the representative of a class of medication. Okay. So they may be the first type that they came out with. They may be something, you know, that worked for a very long time. And typically you can use this for ease of memorization or making predictions as to how other drugs of that class will have an effect, whether it's adverse effects, how long it's going to take, whatever have you. Okay. Sometimes, however, prototype drugs, they're not always used. Sometimes the provider will choose to use a more newer drug, and this can be for various reasons. Um, the newer drug might have more favorable effects. It may have a longer duration. Instead of having to take the drug 3 times a week, they may only have to take it 2 times to keep the therapeutic level in the blood. Okay, so there's a lot of different things. Maybe even a better safety profile, because some of those earlier drugs, those prototype drugs, weren't always the safest until we developed newer ones that were safer. Okay. Drug names, you have your chemical name, you have your generic name, your trade name, and your combination drugs. Typically your generic names are lowercase, trade names are capitalized, okay? So think about trade names, those are owned by the company, and think about, if you can't remember, think about capitalizing upon something, who's going to be capitalizing the trade name, which would be the owner of the company, okay? Your chemical name, there's only one accepted name. They may be difficult to understand, but they will tell you how a drug is going to work or what it's working on in the body, chemically wise. Okay. Generic names, they are less complicated, and they are far easier to remember. Your generic names are like your ibuprofen, acetaminophen, whatever have you. Okay. There is only one generic name that is accepted. Okay. Your trade names, however, are different. You may have multiple trade names. Remember that this is like a proprietary name, okay? Someone owns this name. They own it for about 17 years, okay? And keep in mind that the ownership, the 17 years, is actually, um, 7 of those years are deducted, because as we learned in our last lecture, the, oh, come on, Ryan. The research and development is actually deducted from that, okay? Because it's part of the whole process of them owning, having exclusive rights to that name. And there are ways that they can extend upon those, but that is, you know, a little bit more in depth and deals with the legal aspects of things. Okay. So, and then you also have your combination drugs, and these are drugs that contain more than one active generic ingredient in them. They can be like your diphenhydramine, aspirin, ibuprofen, um, stuff like that. Okay. The concept here is bioavailability. Okay, keep in mind here that this is all really what this is it's the physiological ability of a drug to reach its target cells and produce an effect. Okay. Bioavailability is affected by multiple things. Um, in this, you can measure it by looking at its inert ingredients and how the tablet is made or compressed. Okay. The difference between a brand name drug and its generic equivalent. Is there one? Oh yeah. Well, oh yes would be like what the pharmaceutical company would say, because they have to make money, right? And you know, other people are like, dude, no. But really the answer to that is unclear. Okay, two drugs may actually have identical dosages, but what's different about them is their formulation. Okay, they may not be the same. Anything that affects drug absorption, anything that affects, you know, how it works or how it's absorbed or anything like that affects the action of the drug itself. Okay, distribution, how it's acquired, whatever have you. Any one of those things can affect the drug absorption. Now my next question to you is, can a pharmacist simply just substitute a generic drug for a brand name? Yes and no. Okay. Sometimes they can, because sometimes the bioavailability is so similar that it's not going to make a big difference. Sometimes the drug is like, okay, well, it takes effect in 40 minutes. Meanwhile, the generic version takes 45 minutes, and so it doesn't make that 5 minutes is not going to make that big of a difference. Okay, depending on what you're dealing with, but you know, you have those factors that you can take into consideration as well. Okay, if a drug shows up on a negative formulary list, it means that the pharmacist must dispense the order as written by the provider. It cannot be substituted for the generic version. That being said, Minnesota does have that formulary list. You have other states too, like Florida and Kentucky and Missouri as well. So, yes, they can give out a generic version of the same drug, of the brand name drug, but if it shows up on the list, they cannot do it. It has to be dispensed as written by the provider. Controlled substances. This is what we're really going to be looking at here is addiction, what it is. First of all, we know that it's the overwhelming feeling that drives someone to use a drug repeatedly. Okay. Dependence is a related term, and it's defined as the physiological or psychological need for substance. When the drug is withdrawn, however, that's when we'll see more of the physical symptoms. You don't really see withdrawal symptoms or physical symptoms with psychological dependence. However, what you will see, or in this case here, since you're not inside the patient, they will have a great desire, a compelling desire for that drug. Okay. Scheduled drugs. In this, we need to know that there are 5 schedules or 5 classifications of controlled substances. Schedule 1 is your highest potential drugs for addiction and potential abuse. Okay, these drugs have no therapeutic use, really, limited or no therapeutic use, and they're intended for research purposes, really. Okay. Schedule 5, these are your lowest potential abuse drugs, and you're more familiar with like cough preparations, okay, with codeine in them. They have the lowest potential for abuse, the lowest physical and psychological dependency as well. Okay, your schedules 2, 3, and 4, the middle ones, these ones are used for therapeutically as a prescription. Some of them are no longer used, and they're still there though. You also need a provider to give you a refill, go through an exam with you before they can give a refill. The DEA has really tightened the ropes on controlled substances. We know this. Hospitals and providers all need to register with the DEA in order to give out controlled substances. And how does that affect you guys? Well, think about when, if you were deployed with us, or, you remember that we had to account for our morphine. We had to have everything written out. We had to know what it was doing, where it was at. The pharmacy itself had to account for everything in the safe, okay, every night, and that had to be sent up to higher. It was very extensive. Because let me tell you, if one of those things go missing, you're screwed. So, you have to have full accountability for them. And in our case, they are only dispensed by an NCO. Okay? So, there it is. The FDA has made a drug risk classification for pregnancy. We do know that we ask a female if she is pregnant, we find out her last menstrual cycle, we find out if she's having any pregnancy symptoms, anything like that, because we don't want to have to give a medication that may cause harm to someone's child. Okay? We assume females are pregnant before we give a medication, hence we ask all those questions. And we also want to be cognizant of the reasoning why as well, because birth defects actually typically happen in the first trimester, that very early stage of development. So if you look at the full slide, you have A, B, C, D, and X. Okay, A is A-okay. It's safe to give. That's all you need to know. Okay. B is be careful. Okay. Animal reproduction studies, they haven't shown any sort of risk or adverse effect, but these risks has also not been confirmed in controlled studies with women. Okay, so be careful. Caution, we don't know either way. We don't know. Nothing has been revealed on animals, and we don't know if there is anything on women in pregnancy. D, don't use. That's all there is to it. However, we can use some of them in times of dire situations, like life-threatening emergencies, or when even a safer drug cannot be used. Okay. And finally, our last category, category X, absolutely not. Animal and human studies have shown fetal abnormalities, and it is absolutely contraindicated. Do not give. Okay? So, I did put a slide in here for critical thinking. All I really want you to take away from this is know the difference between a therapeutic and a pharmacological classification. Know about prototype drugs and how they differ from drugs of the same class. Explain the drug schedules. Explain the risk, the teratogenic risk and their classifications. And I wrote in this little scenario here too. The medic is about to give a medication marked Schedule 3 drug. What does this information tell the medic? It should tell you a lot. It should tell you that, I'm giving out a medication here, and the patient is going to have to come back if he wants more. If he or she comes back in 2-3 days, and we gave enough for a week, and it's gone, problem. Red flags up in the air. Okay? Lots of different things that just knowing what Schedule 3 says, or Schedule 2, or Schedule 4, all of those, what those say, is, it tells you a lot. And it prepares you for how you're going to teach the patient. It prepares you for what you need to do as a primary caregiver. I mean, out in the field or whatever have you. Not that you would be giving out those, but I mean, your patients that may come to the aid station may leave with a controlled substance. And so it's important to recognize, who's taking them, how they're being taken, when they're being taken. If you're that worried about it, then you are by all means allowed to dispense the medication on time, which means you hold the controlled substance, and when it's time to give a dose of that medication, they come to you, you hand them the dose and do the med pass, and that's that. Okay? I've had to do it once or twice. They get a little pissy about it, but hey, it's my job. I'll keep my job, thanks. So, anyways, critical thinking questions, write them down, answer them on your own. If you have any questions, go ahead and send it to me in the group. Take the time to learn these things. They're very interesting, and they really will impact your practice as well. Okay? So, I think that's all I have for you tonight. I'm going to get some rest because it's way early in the morning for me. And there we go.